This video is going to review some first aid management for common dental injuries. So number one, we have a broken tooth or a piece of tooth that's fallen out or chipped or something. First thing we want to do is rinse the mouth with salt water. So we've included some salt packets. You can just add this to a bit of warm water and let the patient swish and spit to try to clean out any debris around that area. Then you want to floss anywhere near there just to see if anything's stuck in that area, so you can get the floss pick out and really just get in there and really clean around any adjacent teeth and really make sure we've removed any debris around the area. This is especially true if you have a chipped tooth like this one here. You're trying to get any extra debris away from that to prevent infection. Then you want to pat the area dry, so you can use some gauze. And so this is if we have a chipped tooth or a missing tooth. We really want to dry out that area as best we can. So we're just going to use our gauze to do that. If the patient is bleeding quite a bit, you can actually place the gauze over the area and have the patient bite down and do that for a while to control the bleeding before doing anything else. So have them do that, control the bleeding. Once it's controlled, then we can worry about trying to create a temporary filling for it. So once it's all dry, there's nothing coming out of there, what we're going to do is create a temporary filling using dental wax. So this is the wax that they commonly use for the back of braces to prevent them from hurting the back of your mouth. So you can actually take off one of these sticks, break off a piece, and you can kind of mold it in your fingers. You want to roll it around a little bit. This will kind of warm it up and make it more moldable. And the whole point of adding the dental wax is if there's a exposed nerve, as there often is in a chipped tooth or a missing tooth, this just helps to block that to control the pain. So we can kind of place this in the area where the tooth was missing. We can either use our Q-tip to try to mold this down, or the floss stick works really well for this too. So you can use this to really mold into that area. And the advantage of this is it's not harmful if swallowed, so that's fine. You have a good bit of this in the kit, so if you do one and it falls out, you can replace this over time. You can do smaller areas too. So here we have just kind of a hole over the tooth. So again, we can kind of pack this one over, and then we can mold it. We can even cut any excess with the floss to remove it. And then we can really just mold this in to that tooth. So this is really going to help block that nerve ending and to control some pain. So you can do the temporary filling with the dental wax. Then to further assist with pain, you can use tea bags. These work really well. So actually open this up, put it in some boiling water, let it kind of soak for a bit, then take it out, let it cool off a bit. So you don't want to put this in boiling. Wring it out. So you will open it up, add it to the water, get it soaked, steeped, let it kind of cool off, wring it out, and then you're just going to add that tea bag over the exposed area, and the patient can bite on that. And that's going to help reduce some pain. So then other things we can do, kind of ongoing management, is avoid extremes of temperatures with food and drinks. So try to let things be kind of roughly room temperature before they're eating them. Avoid chewing with that affected area. Avoid sugary drinks and candies. Advise the patient to brush their teeth twice daily with a toothbrush. Remove the wax and replace it as needed. And they should really rinse their mouth with that salt water up to 4 times a day if possible. And then get them to a dentist as soon as you can, where they can actually repair and do a more permanent fix of the area. So that's some first aid tips for management of dental injuries.